So welcome to this session on health misinformation crisis, how libraries can help. It's my pleasure to be co-chair of the Health Libraries Group with Leslie Allen, and many of our roles in terms of the committee are indeed joint roles. So it means that we can actually share experiences and work together. In terms of HLG itself, the Health Libraries Group, we're actually one of the longer standing groups within the CILIP family. We were founded, or our predecessors were founded, back in 1947. So we're actually a year older than the NHS itself. Our libraries include the Royal Colleges, so that's the professional associations, universities, voluntary sector, commercials such as organisations such as the pharmaceutical industry, but also the NHS itself. And we also welcome members from other sectors who have an interest in health information and health libraries. So thank you for joining us today. In terms of the different elements of our offer, one of the main things that we're known for is we have a biennial conference, and our biennial conference this year is a joint conference, which is the International Congress on Medical Librarianship being hosted in Glasgow. So I'll be putting the details into the chat shortly, but you can come to join us in terms of that event. It's a 3-day event in July from the 14th through to the 16th. You can join in person, or the rates in terms of day rates go from £125 upwards. So it's a fantastic way to learn more about the sector. We also have quite an extensive programme of CPD events, different activities, learning and sharing in terms of health information, health librarianship, and different related issues. So quite a lot of things to do with AI and misinformation just at the moment, for example. It's then our pleasure to be able to offer bursaries to attend events, really to help people with their CPD. We have awards such as the Cyril Barnard Award for Lifelong Achievement and a new Bob Gann Award for Health Information, of which more details will be issued shortly. We have journals, we have newsletters, we have the Directory of Health Library and Information Services, or HLISD, sometimes lovingly known as the Health Lizard, which, if you want to have a source in terms of where not just NHS libraries, but voluntary sector, wide range of different organisations are listed, you can find out what's available within your own locality and share it with others. And then we have core collections. People have worked together to share their expertise to select the core resources. But we also, in terms of offers to our membership, have international relationships. So more formalised offers in terms of having relationships with the Medical Library Association in the United States, the Canadian Health Libraries Association, and also the Australian Library and Information Association. So information exchanges, reciprocal conference places, sharing that learning globally. We're proud to support CILIP in terms of its policy work, and we do sometimes draft responses for CILIP or respond in our own right to different consultations. And our CPD offer includes sustainability issues, and we do try to ensure that we take a sustainability approach to all of our work, such as looking at sustainable travel and accommodation for our conferences themselves. So assuming technology allows me to do so, I will be putting details through into the chat in terms of these different links to the different offers. But thank you for joining us today, and do join us if you would like to know more about our work as the Health Libraries Group.
So just to give you the structure of today, and also probably should introduce myself, just to say I'm Sophie Castle. So I am a clinical librarian. I've been in post for about 3 years now, as outreach librarian, I suppose you say, clinical librarian. So I've been in libraries for quite a long time, but this was kind of my first introduction to health misinformation. So I'm going to discuss misinformation as a whole, as well as health misinformation. I'm also part of the CPD group for HLG, and I'm a project officer, so I'm also looking at things like chartership. Anyway, right, so we're going to discuss today what health information is. I've tried to make this session quite interactive, so there are some Slidos, as well as for the second part, there will be discussion groups. If you feel you want to leave at that part, then that is completely fine. I know it isn't for everyone. Everyone will get copies of the slides. So anything that you miss after the discussion part, if you don't want to be involved in that, again, completely understand. The groups will be around 5 people. We're going to keep them quite small in case that makes a difference as well. So we're also going to look at how to spot misinformation, practical toolkits, communication strategies. Then, as I say, we'll do the network and sharing part. So feel free if you don't want to stay for that part, again, completely understood, or if you want to keep your cameras off. And then last point will be building an action plan. So then how will you go forward from this training? I'm very sorry because I think because we were a little bit late starting, we may finish a little bit late. Again, I understand if people can't stay, but it has been recorded, so you might be able to go back and watch it at a later point. Right. So we're going to start straight away with the Slido, otherwise you just hear my voice all the way through. So I like to make it interactive. What word or phrase would you associate with misinformation? Again, you don't have to take part in this. You can just put it in the chat if you'd rather. But for anyone that can do the QR code, or you can go onto the website and you've got your hashtag number there that you need to enter. Fantastic. Yeah. Yeah. Fake news, I have seen so much in my research. Oh, I like the way this is coming up as well. I like someone's put Trump. Yeah, feels like it, doesn't it? Yeah. Fantastic words here. Yeah, this is really good. Yeah, and again, I agree with the frustrating, especially from a professional point of view. Oh, amazing. Yeah, yeah. Social media, and we're definitely going to be discussing that today as well. Yeah, yeah, and it is endemic, sadly. Oh, these are fantastic. Unverified again, we are going to look at how you verify. Yeah, and health literacy we will be talking about as well. Fantastic. These are all really good. So I'll just give you another few seconds in case anyone else. Yeah, we're also going to be talking about the anti-vaccination stuff as well. And manipulation, again, completely agree. And again, it's something we will discuss. Oh, these are fantastic. Brilliant. Yeah. Again, I agree with all of this. And we are going to talk a bit about disinformation because it's slightly different to misinformation. So we're going to look at how we define each of those. Yeah, potentially fatal. And again, yeah, we will talk about that because especially when it relates to things like medicines. Oh, thank you so much. I really appreciate people's contributions here. Yeah, fantastic. Yeah, alternative facts. Yeah. So I'm going to go on from this. Oh, sorry, it's got three people typing. Let you finish typing, and then we'll go on. Amazing. Thank you so much. So we'll look at the scale of the problem. Now, this is a fact from actually from 2022. So I think the 52% is probably higher now. But at that point, it was 52% of internet users who searched for health information online. So that is a very high percentage. Some of the research I read actually went as high as they think it's more like 70%. But I wanted to go with the proper stats. But as I say, we're talking a bit of a difference now with the use of social media and things. Health misinformation was highest on Twitter, or X as it's now known. And some studies were citing that 87% of posts contain misinformation, which is quite scary, really. So, billions, because of this, are wasted annually on unproven treatments and remedies. So I won't read everything on my slides. Some of this you can go back and read later. And also I've tried to cite so that you've got things to go back and look at. If anyone would like my full list of references, I'm quite happy to send that out afterwards as well, because I did do a lot of reading for this. So, what is health information? Now, I must admit, before I started doing the research on this, I didn't realise the difference between misinformation and disinformation. I think I may have been using them interchangeably. But misinformation is the spread of false information without the intent to mislead. So, it's unknowingly done. Those who share the misinformation may believe it's true, useful, or interesting, and don't have any malicious intent towards the recipients they're sharing it with. Whereas disinformation is actually to deceive or mislead someone purposely. So that is the big differences between them. And also, you've got malinformation as well, which I won't go into today because we've got quite a lot to cover, but just so that you've got another definition there as well. Where does it come from? So, what was fantastic in that word cloud just now is social media did come up, and I think that is one of the big ones, especially now. So, you've got lots of different generations using social media, and I think TikTok as well is quite a prime one where misinformation is shared. And as I've said here, algorithms favour engagement over accuracy. So they want people to come and use their platform. They're not as worried about actually how accurate it is, which is quite scary. It can come from word of mouth. It can come from the media, and we will discuss that a little bit as well, and the press. Predatory websites, which I think if you are a health librarian, you have probably come across as well. But again, you may have just in day to day. Influencer culture, again, that very much to me points at TikTok. And distrust in institutions. So that can be generally people that come and use, say, like the NHS. Yeah. So I wanted to use this as a real world example. Some of you may have come across this on social media. I came across it and was very confused. So, how it was posted, so I saw it on Facebook. I'm one of these old-fashioned people that still use Facebook. But it came up on my feed as so I'm going to read it exactly as it was. Agnes, 78 from Leeds, says she was just focused on getting home and having a nice cup of tea. And they're saying she was given this leaflet and the outrage, the amount of comments, and it really was kind of leapt upon. But when you look deeper into it, actually, that's not what happened at all. This is an old post from 2022 where an international footballer was given this leaflet and he was laughing about it and just posted a picture. And actually, one of my colleagues pointed out, even with this picture, the NHS Tayside logo doesn't look actually correct. So that might be another thing that has been changed on this, but I'm not entirely sure. But it shows how someone has, it may have even been put as a joke. But where it was posted and actually wasn't true to the original post, it shows how it kind of was blown up and people were really getting upset about this, but they didn't know what the original story was. So it's a really good kind of real world example of it, I think. So I'm going to ask you, have you personally, and again, you can put it in the chat if you don't want to go on to Slido, but have you personally seen any examples of health misinformation in the press, media? I say it might be a not sure because you may not know. I like that there's no no's though. That's quite telling. But you're not always aware when you see it. So I think I would kind of veer between yes and not sure, I must admit. Yeah, thank you so much. As I say, I really appreciate the interaction. Otherwise, you just have to hear me talk. So, why are libraries best place to help? So, I've tried to make this broad. So, although I'm a health librarian, actually, I think this encompasses all libraries. So, alarmingly, misinformation has been found to spread more widely and more quickly than accurate information. I think you could apply that. So, we're looking at health misinformation, but I think you could apply this for any misinformation. So I would highly recommend this book as well. I found it really, really useful for tips on combating online health misinformation. But the reason I think that we are in a good place, we're trusted and neutral. So we aren't a judgmental place. We are someone people can come, they feel safe. We are the information experts. So even if we're signposting people to things, they are coming to us to ask, which I think is really, really important. And librarians are very much trained in research and how to evaluate sources, which is so, so important for when you're battling misinformation. We also serve really diverse populations. Again, whatever sector you are in, we see a bit of everybody really, and especially those that would be the most vulnerable to misinformation. We also have lots of partnership working as well. So, as I say, I'm NHS, but so it doesn't really matter, again, what library sector you are, you will be partnered with others. So, often public libraries and NHS libraries are partnered together as well. So I thought I'd talk about some practical frameworks that you can actually use. This one I really like. I have adapted it from Mike Caulfield's original guide. So again, I've got a link to that, and you will have the slides to be able to go into these links. But I really like this, and I think actually it's quite a nice way to break it down. So it's called SIFT. Some versions are called sifted, but I like to simplify. So I think this is a really nice way to introduce it to other people, as well as to think of things yourself when you're looking at information. So it's stop, investigate the source, find better coverage, and trace the claim to the original. So I think it's something we probably do without realizing we're doing it, but this just breaks it down into really nice steps. So I think again, if you're looking at, so if we're talking about media headlines, so you've got a really alarming headline there. So actually, stop and think about that. Investigate where did they actually get the information from. Um, if it's only one particular website, one particular member of the press, so say it's a spreadsheet, broadsheet even, sorry, um, then actually, if they're the only ones reporting on it, why? Then actually go back to the original, go back to where they've quoted things from. Is it just a single study? Um, is it actually something where it's an opinion piece even, or is it something a bit more in depth? So it's just little things like that. But I really like this one. The other one that I really liked is FIRST. So first indicators, again, really nice acronym, really easy to remember. So again, fabrication, is there any manipulated content? So is it a forged document or something like that? Has the image been manipulated? I'm not going to talk too much about AI, but obviously things like AI for manipulated images are being shown more and more, especially on social media. Identity. Does anything point to a disguised or misleading source? Or are there false claims about someone else's identity? So again, is it being posted from a fake social media account? Is the person actually an expert in the field? It's just things like that to kind of look at. Rhetoric. So is there kind of false arguments in there? Are they fully backed up? Symbolism. So again, are events being exploited? So a good example of that is maybe a new drug has come out. And actually on the news this morning, I was listening to BBC Radio 2, and they were actually talking about a new drug that's going to help with epilepsy. But actually, it needs a lot more testing yet. So the BBC coverage was absolutely fine, but it'd be worth looking, because I think newspapers today will be like, miracle drug, we're going to cure epilepsy. And it's actually, well, what's behind that? And we need to look further into it. And technology. So actually, has the technology been used to kind of trick or mislead? And that can be anyone that's reading it. Another thing that you can use is called the red flag system. So again, I think this is really nice to use with someone that maybe doesn't know how to really assess the information and know whether it's from a trusted source. So I really like, again, this is simplified. These are my own thoughts. So you can probably add and think of lots more, but feel free to use this. But things like, I really like the fact that it's something you can flag up to someone is, well, are they claiming to cure or prevent things? Actually, how do you know that? What evidence have they given? emotional fear-based language. So these are things that people might not consider. To say, I won't read everything off of all my slides. I'll let you read back things later. Um, but I do think it's really important to actually flag some of these things up. So this is what's like the red flags that you can just talk to people about. So even things like the vague language used, and I'm sure we've all seen this, where it's scientists say, research shows, and it's like, well, that's fine, but actually, where did that come from? How have you quoted someone? Actually, have you looked at how they got to their results? It's just really important things like that. Even down to looking at domains as well, which I always think is really important. Is it a .com domain? Or is it a government website, an NHS website? And again, things like that and teaching. I mean, my daughter's 11, and even now I am teaching her things like that. I think even from quite a young age. So if you do have a younger customer base, it's actually really important that they learn things like that quite early on. So again, you can probably think of many, many more, but I just wanted to give some key trusted sources of health information. Um, I like, as you can see, I like to simplify, so I like this layout as well. So again, feel free to use these slides. I'm perfectly happy with that. But I just thought this was a nice way to break it down because we may know the best websites to do, and even things like the fact to go to the National Health Service website. That may be obvious to us. When you're speaking to someone else, they may not have gone to there first. And that it might be they instantly go to Google, or as people seem to do now, use AI as a search engine. And actually, it's quite nice to be able to say, well, actually, have you gone to a trusted website? Have you gone to an actual medical website? So these are what I think of as quite obvious ones, but they're not obvious to everybody. So I just wanted to kind of do a list just to highlight the use with care. So I don't want you to think I'm anti AI, anti Wikipedia, any of those. So it's just letting people know it's a good starting place, but actually, again, verify. Just double check where the sources came from, how they got to that, especially with somewhere like Wikipedia, because anyone can edit it. They're usually really good with their citations and the references, but it's just making sure. And again, I could say I've put Google Scholar and academia.edu because again, just verifying that's all. So I'm not trying to say don't use it. And so yeah, so and I'm not saying that everything posted on social media is misinformation. It's just making sure people verify and look at the sources rather than just believing it at face value. So I found it really interesting. A lot of my reading kind of led to me writing this up because I hadn't actually thought of how you then approach someone. And I'm not saying I'm argumentative, but I must admit, if I hear someone say something and it does point to misinformation, my first instinct is I must correct them. But actually, there is some really, really good literature out there that says about how to approach it. So don't just instantly disagree with someone, educate them in how to look for misinformation themselves. And actually, that makes a lot of sense. So I really like this. So this is kind of my breakdown of it. So leading with empathy. So why are they actually sharing this information? And actually, it can be because they think they're helping someone else. So it might be that they care about the health of someone else. They hear about this health condition. They're doing word of mouth and telling them, oh, I found this brilliant social media post. This will make everything better. Actually, why did they share it? And when you're talking to someone about that, actually don't use jargon, speak to them kind of on the level they are to find out why they shared it and what they think actually the benefits of it were as well. Again, I won't read everything on here, but it is the like don't just debunk, which is what I said I would probably have done before this, actually, to be honest. Directing. So a lot of what we do as health professionals or information professionals is signposting. So we know we can signpost them to credible sources where they can double check. And I think actually knowing that signposting is a key part of it is also really important because someone may not believe what we say. They might think that actually they know better, which again, absolutely fine. But if you refer them on and they do the research themselves, that can be really, really helpful. So also communicating with colleagues and teams. So misinformation, it's not just about the public or say our customers. It's also health professionals and library staff as well. I mean, I've been caught out myself. So I didn't share the information, but until I looked into it, I took it on face value and shouldn't have. So it can catch anybody out, and it's nothing to be embarrassed about. There's so much of it out there, actually. If you think of the amount of information we're inundated with, it's no surprise there is so much misinformation. So these were just some things that I thought would be useful for going forward. So things like maybe modelling good practice yourself. So again, with my presentation, I made sure I've cited everything that I've used. And I haven't put it on the presentation, but I do also have a reference list if anyone wants to know my further reading. Using team meetings, so actually discussing as a team, actually, this came up, what do we think about this? But and again, I quite liked this as a don't, where as part of my reading, I was thinking, well, actually, you want to speak to that individual because you don't want to embarrass them. So if someone has sent an email or maybe done a social media post, you do want to be able to speak to them, but actually do it one on one. Don't say it in front of a large group because actually sometimes people can get defensive or it can be quite upsetting. So actually, that's quite a nice little thing which I hope people can take forward as well. And I've done a little bit of a practical toolkit. So these are things that you can use straight away. Some of them you will already know about. Now, NHS England, I didn't want to play it today as part of this because I've got quite a lot to cover, but they have done an amazing video for Misinformation Unmasked, which I'm going to highlight, which is really good to be able to share as well or to put into presentations or anything like that. So just to highlight that, and you will have the web link there. Again, CILIP and their health information literacy, very, very detailed. There's courses you can attend and things as well, which are really helpful. I was lucky enough to go to some training for the PIF-TIC as well. So that's the Patient Information Forum. And actually, when you look, they will give a special green tick to verified websites. And that's a really interesting information forum to go and have a look at, I would say. And I have got a couple of others on there, but just to give you kind of a starting point. So we're now going to go into the breakout activity. What I would say is if you don't want to be part of this, I completely understand and do feel free to leave. What I'm going to do is break it up into groups of around 5 people. You'll go into a group randomly, so it's going to be 10 minutes just to discuss health misinformation. Now, I've put in your work, but it can be in a personal context as well. If you could have someone to take notes. I am not going to go group by group, so it will be sharing back if you want to share back. But I think it would be nice if you do nominate someone so that if anyone wants to share anything back. So we're going to have 10-minute breakout and then probably about a 10-minute discussion before I do the rest of the slides. Would anyone else like to share?
So there's a comment in a chat about the long tail of the MMR misinformation, and as well as AI being used in academic publishing as well, which again could potentially hallucinate and all sorts of different things depending on where it's pulling that information from too. So a couple of comments in the chat as well.
Oh, fantastic. Thank you.
Can I just share something that happened to a friend of mine?
Yeah,
Because I
cool.
think it's a really scary story about misinformation. So my brother-in-law had bowel cancer, and he was diagnosed. The day he was diagnosed, he was having blood taken in the hospital, and the nurse taking his blood, when they were alone, so asked him if he'd had the COVID vaccine, and he said he had, and she said basically that explained why he would now found himself with blood with bowel cancer. And for me, it rolled around in my head for a really long time because he's a very intelligent person with a very close knit, family who was able to see how ridiculous it was and be very angry about it. But he was in the most vulnerable position anyone can be in, which is that he'd just received a diagnosis, and a health professional had waited until they were alone and no one was around and literally told him it was his fault. So yeah, for me, it shows you how deep some of this stuff is actually
Oh, yes.
going.
Yeah, thank you for sharing that. And that's quite scary, really. But it does show even kind of health professionals can, yeah, be influenced by misinformation if they don't realise it's misinformation. I mean, COVID was such a massive one. I haven't gone too much into COVID on my slides because obviously there is so much. But yeah. So sorry, just anyone else for last comments? Oh,
Just to
Janine,
note,
yeah.
Yeah,
sorry, gone.
sorry. We were discussing I guess, the rate increasing the number of anti-vaxxers that there are out there, and people saying what they're injecting into you is microchips and all sorts of things.
Mm,
And how would you go about promoting good health information? Because I guess years ago you had about getting vaccines and the road safety information, and where would you do that? Because not everybody watches. You don't have the five channels now. You've got Sky, you've got your Freeview, you've got your Amazon. So how would you go about promoting that? And I think somebody said that I think it's their son's girlfriend's mum or somebody. They reading information online, and basically everything gives you cancer. And it's like checking where they're getting this information from, and maybe introducing maybe a bit of element of common sense and I guess rational thinking, and maybe checking the information.
yeah, thank
That,
you. Yeah.
I'll just add quickly in the chat, there's COVID's come up a couple of times as well, and as you've mentioned, for all the reasons there, as well as misinformation and the sort of anti-vaccination movement too. Someone's mentioned about trauma as well, and again, COVID was a very traumatic time, and potentially that kind of plays into people's emotions, and obviously social media then picks up on those emotions and that sort of stuff as well. So I can see there's someone else wanting to comment too.
I think we're actually overestimating the value of rationality here as an anti-misinformation strategy, because misinformation and disinformation are in a sense relational and networked, are relational and they're networked, and we are increasingly shifting and have been for some time into what you might argue is a bit of a post-truth era, and in which we are increasingly ungrounded from truth and ungrounded from sources of canonical truth, and living in and kind of coupled with an increasing sort of discomfort with complexity and discomfort with uncertainty. That's a bit of a toxic mixture, and I am not convinced that rationality is the way out of that. And I don't know what the way out of it is. But the way out of it is, you were talking before about empathy and relationship, and I think that's maybe more powerful in the longer run than rationality, because I think the appeals to common sense and possibly even the appeals to evidence um, don't. I'm not sure that's going to get us anywhere unless they are somehow grounded in the development of relationships and communities. And there was discussion about this issue about trusting the government, and the reality is governments are giving communities reasons not to trust them right now, and we can't not we can't not look at that. That's actually quite important. And a lot of the communities that then get people then look and say, oh well, they're falling prey to misinformation, are precisely the communities that are being given good reason not to trust people in power. So
Yeah,
that
thank
was my
you.
comment.
Yeah, no, thank you. That was, yeah, really insightful. I am going to move us along now, sorry, just because of time. I completely understand we probably will overrun, but I understand if people can't stay. But this is recorded, so you can go back and watch it later. So I've just got a few more slides, really, just to now think about what we do going forward. So actually building information literacy in your community. So I think we've kind of discussed this a little bit in how it's getting people to actually look at where that information came from. So we're not just looking at individual things, but as a whole, how people can help themselves and how they can look for the misinformation. So these are just some ideas. Again, there are probably lots and lots of other ones you can think of. But health literacy workshops, so again, that can be any sector. So it's looking at evaluating health information, where you get the health information from, things like reading lists, digital training skills, so even down to showing people how to get to those websites, how to use those websites. So health librarians tend to do a lot of training in database training. So things like PubMed, it's something we can help. So that's a good way of helping health professionals as well. So as I said, using things like the indicators. So I really like First and Sift were the two that were my favourites, but there are others out there. But I think they simplify things, which is quite nice. And even as we said earlier about networks, even things like going into schools, targeting people from quite young, as I was saying, my own example with my daughter, it's just really important, especially because of the amount of exposure that younger ones are getting to social media as well. Yeah. So although my daughter isn't old enough for TikTok, she watches a lot of TikTok because she watches YouTube. So she kind of bypasses it. Things like that I find quite scary, and I think it is that sort of world now, unfortunately. So that again, we talked a bit about vaccines, and again, I'm not going to read it word for word, but uh, the World Health Organization, so they actually rank vaccine hesitancy as one of the top 10 threats to global health, which I thought was actually quite shocking in itself. So again, it's why we as libraries play a key role in providing the actual accurate information. So again, I've just broken it up a little bit and just given the NHS website there for the vaccinations. They break it down quite nicely on the NHS website. So it's got age ranges, the vaccinations that are due, and it's always changing as well. So it's things like the fact that there are now extra vaccinations for pregnant women and things like that. So again, it's good because it's always being updated, which is something we can kind of put across. But yeah, so I won't read all of that, but so you can go back and read these. So I just thought about going forward. So actually, what can you take from this training? What can you do going forward? So again, these are just some ideas. It doesn't have to be these. You can probably think of your own things as well. But it's just those little steps that perhaps we can take. So for example, with the bookmarking the trusted health information, I've learned quite a bit about different websites I hadn't used before. And going on the PIF training course, I learned about PIF. So these are now trusted sources that I can now recommend to other people. So I think actually sometimes for me personally, I found the learning about these things, I can now recommend them. So that's just a little thing I can do. But it can be a stock related thing, it can be about reading lists. And I've also put kind of the longer term projects, so things like health information literacy, maybe building a course on it. Maybe if you are in public libraries, linking with your local NHS library. Again, it's just a way of kind of linking and reaching more people. So, learning outcomes from today. So, we've looked at different lists. So, as I say, First and Sift were the ones I adapted and I much preferred, but there are lots of different ones out there. The red flag checklist, which I thought was actually a really nice layout for the slide, so that that can be sent to someone as quite a nice, simple breakdown as well. We looked at communication strategies, so addressing health misinformation, but not just in the NHS, so patients, health colleagues, also people in the community as well, and whoever your customer base is. We network with other librarians, and I hope you found that part useful, so that you could actually discuss it among yourselves. And it sounds like quite a lot of the same stories came out, which does show that we're all understanding what misinformation is and we all want to counter it. And as part of this presentation, I'll have like a practical toolkit so you can use some of those and keep adding to it. So this is the thing, I found some key things, but as you find things, add them. They're all part of your toolkit. So yeah, the key takeaways today. So we know health misinformation is pervasive, sadly, and can cause some real harm. And thank you for people that shared their examples as well, because that really does show the harm that it can cause. But it can be countered, hopefully, little steps. So the reason for part of this presentation is that we as library and informational professionals, we are in a unique position really. So it is something that we can help with, even if it's just in small ways. Yep, so we looked at the practical frameworks, we looked at communication and not just debunking, so actually showing what can be done next, what you should look at in like people informing themselves of misinformation, information literacy being a long-term investment, which I think we all know anyway. And the fact that you can use professional networks. So actually, it's quite nice to know there's other information professionals that are dealing with the same things you are, and we can share practice. So that is the end of my presentation. I really hope you all found it useful. I've said to Paul, we're going to send out the presentation so you can look through it at your own pace, but also I will put the reference list there because the librarian in me, I've read quite a lot around the subject, so then at least you can have a look and see where I got some of the information from. But thank you very much.
Sophie, and thank you for that presentation as well. I think it was, the engagement you had from a really wide cross section of the librarianship community was a credit to this session, I think, and just shows how relevant it is to many librarians. On that note, if you are not a CILIP member, this is part of CILIP Members Fest, so please do consider joining up. We have many different events that we run across the year, details of which in a second. And you'll also find a home in many different special interest groups as well that speak to pretty much every sector across the librarianship and knowledge specialities. There are still CILIP Members Fest events happening for the remainder of this week, so please do have a look at the link and sign up for anything else. And our events as well. We've got a couple more forthcoming events. An AI trainer event, which is happening later this month. Please do consider signing up for that. And of course, we also have the International Congress of Medical Librarianship being hosted in Glasgow this July. So again, registration is still open for that too. This and all our CPD is on our YouTube channel. So again, you'll find the recording from here in a couple of weeks' time on that. So finally, just to say thank you so much for Sophie. Thank you very much for attending, and hope we will see you again soon. Thank you.
Thank you.